each person is going to have, based on a few different factors, what they feel will be the best situation for them. How people should approach kind of making that comparison for their own decision is simply weigh those different topics that I just mentioned there. Think about your own situation. You're in a situation where your health isn't a concern. You typically don't see a lot of providers or use a lot of medications throughout the year. Maybe that lower coverage is going to be better fit for you because you'll save some money.
There we go. We are live. Seeing some people starting to roll in already. But yeah, feel free to ask any questions in there as we go through this. At the end, we will go through all of your questions. These are going to be more for general educational type questions, which kind of brings me to the fun side of this, the disclosures for all of you attorneys and compliance people out there. Nothing that we're going to say today is advice. This is all purely educational. We're here to give you as much education and information on the topic as possible. Please, please, please do not try to take this information, go off and run with it and do it on your own. If you have any questions, there are plenty of people out there, plenty of specialists out there like Dylan that you can contact, that you can ask all these questions to and make sure that you get things set up the way that you need for your specific situation. So with that, I'd like to welcome everybody and thank you guys for coming in today. For those of you that don't know, my name is Jaimin and Medicare. I run Assurance Wealth Management. We are a holistic financial planning and retirement planning firm that we host these about once a month with different specialists looking to get you guys as much education and information on a number of different retirement topics that we can. Today we have Dylan Sunderland of the Sunderland Group. He, as you can tell, just like I do, works with his father. His uncle is also part of their group there as well. And they specialize in Medicare and Medicare planning and helping people get enrolled with Medicare. So he's going to be our expert today. He's got a lot of good information to share with us. Dylan, thank you for coming today.
Thank you, Jaimin. Super excited to be here.
Yeah, so let's just go ahead and dig into this information. We're about 5 minutes in, so we're looking to spend the next 40 minutes or so answering a bunch of the most common questions that we receive on Medicare quite often. Dylan will help us kind of navigate through Medicare and what it means and what it is and what you should do when it's time for you to enroll. And then, like I said, at the very end of this, we will leave this open to question and answer. So feel free to write down your questions or just go ahead and ask them and we'll get to them at the end. So Dylan, tell me a little bit about yourself. I mean, what got you into Medicare and why that topic?
Great question. It's one I get often. I'm a little bit younger than most Medicare agents that I typically interact with. So something that comes up. And my start in it, I would say, my family's been in the insurance business for 3 generations. Oh, wow. Retirement planning, wealth management, all sorts of different aspects of the business. And I really just was gravitated towards working with people, helping them solve problems. And at the end of the day, Medicare is one of the most common problems that people run into with their retirement planning. It's so confusing. There's so much information and there's so many people that need to deal with it. So I just kind of found a niche there, and that's where I got my start about 3 years ago now. Awesome.
Yeah, I mean, you know, the two biggest expenses in people's retirement tend to be healthcare and taxes. So this is a big topic for a lot of people. Exactly. So when we're looking at Medicare, I mean, what is it? What is Medicare? Who's eligible to receive it? I mean, where does it play into the role of retirement? Yeah,
Medicare is federally funded insurance. It's an insurance program that most people think of is for 65-year-olds and older. There are some ways that you can qualify for it if you're under 65, certain qualifying disabilities, but primarily it's focused on the 65 plus market. It's a way for you to get access to quality health care. Typically once people are starting to retire and they leave their employer-sponsored plans, a lot of times people run into situations where they have not dealt with these decisions before because those decisions are made usually by their employer. So Medicare comes along and gives them that access to quality health insurance once they are out of the workforce.
Sure. Okay. And you and I spoke the other day about this, and now seems to be a perfect time for this because it is the open enrollment period, correct?
It is, yeah. Annual enrollment period is October 15th through December 7th. It's the one opportunity every year where all Medicare beneficiaries are going to get an election period to make a different enrollment decision. And I'm sure we'll cover it at some point later on. Enrollment periods are very relevant because they're the only times when you can actually take action with your Medicare plans.
Okay. So when somebody's going through the process of enrolling, let's say somebody's 64, 64 and a half, or 65, or maybe they just left their company and they need to get Medicare now. How early should they start that process?
I usually recommend to people when they ask me this question that they start learning about it around their 64th birthday. It gives them a lot of time to prepare and get ready and digest some of the information. There's multiple different parts to Medicare. So giving that time when you start at 64, it gives you time to prepare for it once you get 65. The actual enrollment process won't start until at the earliest a couple months before your 65th birthday.
Okay. All right. And is that change for people that are 65, 66, they're still working and, then they leave their job, their employment, and they need healthcare now. So how does that work for somebody like that?
Yeah. Not everyone retires when they turn 65. Some people want to continue working beyond that. And if they have access to credible coverage is what the term is called. Okay. They've got access to credible coverage through either a large employer group plan or some other form, then they can continue that insurance and they won't have to enroll in Medicare until they leave that credible coverage.
Okay. And kind of speaking on the route of coverage there, I mean, there's a lot of different parts of Medicare, right? There's A, B, C, D, Advantage. There's all these different terms that get thrown around all the time. What are the differences between all of those?
So to keep it simple, there's 4 parts of Medicare, A, B, C, and D. I think that's pretty easy for people to remember. Original Medicare is parts A and B. So that's what the government provides to you. Part A is hospital insurance. That's coverage for things like inpatient hospital stays, skilled nursing facility, mostly the facility charges. That's what people think of when they think of Part A. Part B is medical insurance. So the other part of original Medicare is the medical side. This is more of the actual provider charges. When you go have different lab tests done or when you go see a specialist, those sort of charges fall under Part B. Part C now, Medicare Advantage. I'm going to come back to Part C and I'll talk about Part D first.
Okay.
Part D is the prescription drug program. You are required once you move into Medicare, once that is your coverage, you're required to have credible health coverage and credible drug coverage at all times to avoid potential penalties. So Part D, the prescription drug program, you can get coverage in a few different ways. You can get a standalone drug plan or you can get it through a Medicare Advantage plan. So let's come back to Part C. Medicare Advantage is essentially a replacement to your original Medicare. There's multiple different ways you can structure your Medicare coverage. It's all subjective to whatever each individual's best fit is going to be. That's kind of an overarching theme with Medicare. I always encourage people to remember that it is subjective. What's best for your neighbor, not going to be best for you. If you and your wife want to be on the same plan, it's not always the best situation. So it's very subjective. Medicare Advantage is Part C, and that's one way to structure your benefits.
Okay, so what are the differences, I guess, when somebody sees Medicare Advantage versus original Medicare? How would they know which route to go?
So again, subjective. Each person is going to have, based on a few different factors, what they feel will be the best situation for them. So the important factors that I feel like should be considered are your health status, your financial situation, your risk tolerance, kind of just your overall thinking on what your approach is to insurance and financial planning, retirement planning, healthcare costs, how you want to deal with those things, how people should approach kind of making that comparison for their own decision is simply weigh those different topics that I just mentioned there. Think about your own situation. Original Medicare, a lot of people feel is kind of limiting with the coverage that it will provide to you. But if you're in a situation where your health isn't a concern, you typically don't see a lot of providers or use a lot of medications throughout the year, maybe that lower coverage is going to be better fit for you because you'll save some money potentially on premiums.
Okay, and you mentioned earlier that the enrollment period, so if somebody makes the decision, hey, I'm 65, I don't see the doctor very often, I don't have a lot of medications, but family history tells me I probably will down the road. I can change down the road if I need to?
Yes.
Okay.
You can change during the enrollment periods. That's typically the only time you're going to be able to change. There are some kind of extraneous circumstances you might get access to a special enrollment period, or potentially your plan will no longer be offered. Then you'll get that special enrollment period. You can move into a new plan. But typically, it's the three main enrollment periods. The first one is your initial enrollment period, right around your 65th birthday. Then there's the open enrollment period, which is January 1 through the end of March. Okay. And then there's the annual enrollment period, which is October 15th through December 7th. And that's really the most common and popular one that people kind of think about when they think about changing their Medicare plans.
Okay. And so if somebody decides, hey, I'm going to get set up with original Medicare or Medicare Advantage, I guess, for that matter, does it cover absolutely everything?
No, neither of them do.
Okay.
So it's important to know how your coverage works for you. A lot of people might assume, hey, this is government insurance, they're going to cover all my needs. The government's a very well-developed system. They know what they're doing. They're going to take care of me. Not always. You got to make sure that you know what benefits are going to be covered. And so Part A and B will cover a list of standardized benefits that's essentially going to cover all of your traditional healthcare costs and facility charges. Medicare Advantage, I mentioned earlier that it's a replacement plan where it replaces original Medicare. Mm-hmm. So Medicare Advantage is going to cover some different benefits. That's something that a lot of people are attracted to Advantage plans, is they see some of those benefits that might be more relevant to them. So it's important to know what coverage you choose and how that coverage is going to work for you.
Okay. So for the pieces that Medicare doesn't cover, are there other ways of filling those holes or filling those gaps?
Yes, there are. You start with original Medicare. That's Part A and B, like I mentioned. Everything really branches off of that. When I'm talking with clients, I usually look at it as such. We start with original Medicare. Everything else is essentially a la carte. It's options. What do we want to choose to best fit what we need? Mm-hmm. And so you start with original Medicare, and the easiest way to think about it is that original Medicare covers 80% of your costs, your healthcare costs. That, of course, leaves you exposed to the additional 20%. And you also need to think about coverage for medications, prescriptions. So you add plans such as a Part D plan, or maybe you look at a Medigap option to then reduce some of the risk that you're going to be exposed to.
So Medigap, would that be like when you hear people talk about Plan G and F and N and all these different letters of the alphabet? Are those Medigap plans, and kind of what do those cover?
Yes, those are. There's 10 different Medigap plans, Medigap options, and some of them are what I'll say are grandfathered plans. So new beneficiaries as of today aren't able to access those. But to keep it simple, there's 10 different plans, and they are lettered and they are standardized. So if you go with a Medigap Plan G, then your coverage is going to be identical regardless of which company you're working with. The benefits will be the exact same. Of course, there's some differences between price and what the company you're actually working with, how do they operate, some different factors to consider, but Medigap plans are standardized. There's 10 different options, and they essentially cover the exact same benefits that original Medicare does. I just mentioned that original Medicare covers 9 standardized benefits, and it only covers them at about 80%. So you'll add a Medigap plan to fill in the gaps. That's why they refer to it as Medigap. It fills in the gaps that original Medicare kind of leaves you exposed to, and it'll cover that 20%. And then each of the 10 different Medigap options covers that 20% a little differently.
Okay. So it sounds like does Medicare Advantage, do you also use Medigap policies with that, or you only use Medigap with the original Medicare?
You can only use Medigap with original Medicare. You can't have an Advantage plan and a Medigap at the same time.
Okay, so if an Advantage plan is kind of all-encompassing or more encompassing, I guess, than original Medicare, what are the downfalls of the Advantage plan then?
I like the way you worded that. So there is, it is kind of an all-encompassing plan. When you go with Medicare Advantage, that's really the big selling point for these insurance carriers, is they're bringing benefits that are not only the standardized ones that original Medicare covers, but they're bringing some more kind of top of mind or more relevant benefits to beneficiaries. So things that you don't get with original Medicare that you can get with Medicare Advantage is going to be, dental coverage, vision coverage, some different home health care, different access to additional benefits you wouldn't see with original Medicare. Now, of course, you said there's some downfalls, some downsides. Like everything, there's each of these different plan options, there's going to be trade-offs. If you go with one option, you're foregoing the alternative. So it's all about weighing the opportunity cost that you are kind of looking at with these plans. Some of the common downfalls that people refer to with Medicare Advantage are that these coverages are network coverage. So you're going to be restricted to the different providers that actually accept that insurance coverage, that plan you go with. Network coverage is a big one. Also, just the fact that you're going to need to pay some more out-of-pocket costs, whereas if you go with a Medigap option, you're typically going to be limiting the costs that you pay out-of-pocket.
Okay, so yeah, you kind of led me perfectly into the next question for you is, how does somebody decide what to go with if they want to continue seeing their doctor that they've seen for 20 years and then they want to continue doing everything just like they've always done? Do both original Medicare and Medicare Advantage give you that option, or do doctors typically only accept one or the other, or how does that work for them?
Only certain doctors are going to accept certain plans, and people, myself included, humans in general, we're stubborn. We want to stick with what works for us, what we know, what's familiar. We don't want to change something that has worked well in the past. So especially when it comes to healthcare, your doctor, having that doctor that you've been with for 15, 20 years, that's important. So you can make sure that doctor is going to be in network. Usually this comes down to, you can do your own research, or you can work with an agent or someone that specializes in Medicare like myself to take a look at the different plan options you have and then kind of weigh that cost. Is this Advantage option going to have your doctors in network? Is an alternative maybe going to be a better fit, even though you'd have to change doctors? So there's many different things you need to consider. And again, it comes back to just it's very subjective for each individual person. But there are ways to make sure that your doctors are going to be in network. It's a lot of making sure that you're setting it up before you enter a plan so that you know how it's going to work once you actually make that enrollment.
Gotcha. So it sounds like there's a lot of moving parts with Medicare, and it sounds like there's a lot of details, there's a lot of decisions to be made. So with things that are this complicated, we see this all the time in what we do. What common mistakes do you see people make a lot, and kind of how does it affect them if they do make a mistake?
One of the really common mistakes is such a no-brainer when you think about it. It's just that people typically don't take action in a timely manner. So a lot of times people will come to me maybe a month or two before their 65th birthday. They won't really know anything about Medicare. They just know that when they turn 65, they're starting Medicare and they know they need coverage. So that's not a end-all be-all, you're in big trouble situation. It just means that you're going to have a little bit less time to digest what is a lot of information, and in a lot of cases can be pretty confusing information. So it all kind of comes down to just making sure that you take the right steps when you should be taking them. Avoid waiting too long. Definitely want to avoid listening to any unfounded or unlicensed information. Don't just be listening to your neighbor or some blog on the internet about what a good plan is for you. It is very common that you see people doing that, and you hear that they get into some plan because they saw maybe a really attractive benefit on some advertisement, and they go and enroll in that plan right away without considering that there might be other options out there. So really the big mistake that a lot of people make is just not considering all their options and not doing it in a timely manner. Maybe I'm a biased opinion when I say this, but I think the easiest and best way to do it is work with a licensed agent that sits and focuses on Medicare day to day, because you might be living your own life. When you're getting ready to retire, you're probably not sitting around thinking about how you're going to coordinate your health insurance for the rest of your life. Someone that's an expert on it and covers it day to day, deals with many different situations, they're going to know kind of more of the intricate things that you're going to not be aware of.
Sure. And then when it comes to, getting signed up and getting enrolled, I've had people come to me on both sides of this and say, hey, I don't need to enroll, right? When I turn 65, they're just going to just take my payment right out of my Social Security benefits. So I don't need to do anything. And then there's the people on the other side of the fence that are like, oh no, you've got to get signed up. Even if you're still working, you still need to get signed up for Medicare and all the different parts of it, so that when you do retire, it's all sitting there and waiting for you, which, if I'm not mistaken, both of those are kind of incorrect. So
yes.
So how does the enrollment part of it work for both of those different situations?
There's definitely, I like what you said there. Both of them are kind of incorrect. There's no one size fits all answer. And that's with really with everything in Medicare. There's no, this is the best route to go, or this is the way to make decisions, because it all comes back to that subjective, what is best for me? How do I deal with these situations? So some people, they do get automatically enrolled in Medicare. How do you get automatically enrolled? That's for people that are currently drawing Social Security. So if you're taking your Social Security at any time before you turn 65, then the month that you turn 65, your Part A and Part B benefits are automatically going to turn on. Now, if you're not taking
Part A and Part B, or do they? I mean, so they can't decide, or it's not going to automatically enroll them in Advantage, or it's not going to automatically enroll them in a gap policy.
Right. It'll automatically enroll them in Part A and B. And that's, of course, unless they go in before their birthday and signify that they don't want them to automatically start. So there are ways to avoid it, but if you're enrolled in Social Security, you will be automatically enrolled in A and B unless you note otherwise. You won't be enrolled in any sort of supplemental policies. Part A and B is the only part that the government actually administers themselves. So everything beyond that, Medigap options, Medicare Advantage, even Part D, they're all supplemental options, and they're through private insurance companies.
Okay. And so if I'm 65 or 64, in 11 months, but my spouse is still working and I'm on their health care plan, do you typically see better benefits coming from the private health care plans or from the Medicare plans? Like, should I get off of my spouse's and get on to Medicare? Or what do you typically see there?
I've seen a mix of both. Okay. I think that for many people, they'll be surprised to find out that the benefits of Medicare are maybe a lot better for them than employer plans. Something that's really common with a lot of large group plans is you'll have a very high deductible. You'll have to pay, which just means that you're going to have to pay a lot out of pocket before the coverage actually kicks in. But again, there's other plans that I've seen where the benefits with the employer plan, depending on how your employer sets up your health insurance coverage, maybe the employer covers a lot of the premiums you have to pay. You could have really good coverage. And coming back to what you said, if you're on a spouse's and you're about to turn 65, you can actually stay on that spouse's insurance as your credible coverage until they retire or they reach Medicare eligibility.
Gotcha. Okay. So it kind of sounds like no matter what people's situation is, it's a very independent answer as far as what they should do. It kind of all is going to come down to their specific situation. Is that accurate?
Yes. I would say there's some categories where you can maybe kind of box people in and say this would be a good fit based on this and this and this, but it all does come down to those individual factors because there's a lot of things that can't be considered by just looking at some of the numbers or statistics that we all kind of carry.
And so where can people go? I mean, other than obviously, our clients are aware of this, that anytime that they have Medicare questions, we typically send them to you, or a specialist just like you and get those answers and help them get enrolled. But for people that don't know, a specialist to go to or don't know who to talk to, where can they find resources or education on Medicare itself?
There's a lot of good information out there. You usually want to make sure that you're getting it from a licensed agent, someone that's working at a reputable company that has experience of working hands-on with clients. You don't want to just Google best Medicare plan and then take whatever the top options are. The best resource that I recommend for people is the government resource. It's medicare.gov. You'll be able to get all of the information that Medicare covers, all of the benefits, all of the plan options. It's all on medicare.gov. The only caveat with that is just that this demographic, most people that are on Medicare are 65 plus. Maybe they really enjoy technology and they've really gotten up to the speed of how computers work and all these things, but there's so much information on there to digest. It's kind of like throwing someone just out in the middle of the ocean and saying, all right, go catch a fish. You don't know where to really start going. You don't know what direction to start swimming or where to go. So Medicare.gov is the best resource, I think, to start. But what you should do is either find a trusted resource like a licensed agent in your local area, or reach out to someone, if you've got an advisor relationship like someone with you, Jaimin, then reach out to your advisor and ask them for a recommendation on someone that's actually in the space and is licensed to give that information.
So what would that process look like? Somebody gives you a call or shoots you an email and says, hey, I want to have a conversation with you about Medicare. I need help enrolling. I'm 64 and 9 months. I need to enroll soon. What does your process look like? What can they expect from a specialist?
What they can expect from me, I like to kind of control their education in a sense, where we start right from the basics. We start bare bones. We'll talk about original Medicare and go into A and B and talk about how it builds off of Part A and B. So that's where we'll start. And a lot of it is going to be information sharing right away. I typically, when I'm meeting virtually with people, it's usually a multiple call or a multiple meeting process. If it's face-to-face, I can sometimes sit and we'll have a longer conversation, get some of that kind of buttoned down. But a lot of it is information collection. I want them to learn about me, how I can help them. I want to learn about their situation so that I know what is important to consider for them. Okay. But really, you start that conversation, say that you're interested in talking, and we'll start with original Medicare, look at the basics, and then we'll talk about your specific situation once we get there.
And would somebody like you help them actually get enrolled, like the logistics of what papers to sign, what to file, or whatever they need to do to actually get enrolled?
Yes. Enrolling in original Medicare is pretty straightforward. There are some limitations with what agents can actually do because a lot of it is through the government. You need to obviously access some personal information right away. need to tie it with your social security number and things like that. So I will definitely help support them and tell them exactly where they need to go to get this original Medicare turned on. Mm-hmm. And then the enrollment beyond original Medicare, we're looking at Medigap, Medicare Advantage, those supplemental options. Yes, working with an agent is going to be no added cost to the beneficiary. So there's no fees, at least with anyone that I've seen before. There's no fees working with a Medicare agent. And if you've ran across a situation where there are fees, then that's a bad situation. It should be free advice. And yeah, exactly. So you're working with an agent. There's no added cost to you. Agents are only compensated by the carriers that actually issue these policies. And so you're working with me. We are going to talk about what's going to be relevant for you. And it's going to be no added cost or no added hassle. Really, you're just going to get access to someone that works in the space and has some experience doing this over time.
Sure. And one thing that I can't help but think about this when you mentioned multiple times that, you are dealing with the government and government programs and whatnot. So when you're coming to the aspect that you're working with the government or that you're working with insurance agencies, the first thing that comes to my mind is how horrific are the billings or the claims or all of that people have to deal with when it comes to Medicare? I mean, have you seen or heard some horror stories and how can people kind of avoid those nightmares when it comes to billing and claims?
Billing and claims is another great piece to talk about why it's important that you work with an agent that you're comfortable with and that you feel understands kind of your different aptitudes and feelings towards these situations. Mm-hmm. Billing and claims can be a big headache if you are enrolled in a plan and you have kind of went about that enrollment alone, you're not working with an agent, then you're kind of going to be alone. You're going to have access to the carrier's support, their agents, their internal team, but a lot of times that can lead to long phone calls, being on hold, waiting for information, someone that's not going to be someone you've talked to ever before, and you're going to need to explain exactly what situation you're dealing with and get them completely up to speed just over the phone in that short time. So billing and claims is a big headache. It's something that even I talk to people that work in billing and claims for different hospital systems around here locally, and they talk about how Medicare can be kind of a headache to deal with. It's just not like other insurances, and that's because there's so many moving parts to it, and it's so subjective for each person. So the best way to really deal with those troublesome situations is talk with someone that you trust and talk with someone that knows your situation.
Well, and kind of along those same lines with billings and claims and the costs that are associated with Medicare, whether you go Advantage or, the gap policies, how would you recommend that people prepare ahead of time for the healthcare costs that they're going to have in retirement?
The best way to prepare is just to self-educate, be a learner. Medicare is confusing. It's going to be confusing going in, so don't be discouraged by that. There's a lot of information to understand, and if you're not someone that's worked in the financial industry or the healthcare industry, there's going to be a lot of new terms and things you're going to need to learn. Mm-hmm. So it's really just be a learner. Knowledge is power, and you take every decision step by step. You want to start with the fundamentals. Once you kind of get those down, you can look at more specifics to your situation. And then once you actually get enrolled in a plan, it's important to know before you make an application or an enrollment decision exactly how that plan is going to work for you. There's always going to be unknowns. I mean, insurance as a whole, it's to protect against those unknown, scary situations that we're all worried about potentially happening to us. Sure. So take it one step at a time. Always ask good questions and look for credible, good quality information.
Perfect. And that's great segue into the next part of this. I mean, it's kind of all I had for you as far as questions that I see on a constant basis, that people coming to me and my clients coming to me with all these types of questions. So I appreciate your answers. I appreciate the information that you've given us on all of that. But now I'm going to actually start going into some of the questions that I've received via email from people that signed up for this. And at this time, I'd also want to open up the Q&A in the chat for anybody else that has any questions. We'll get to those as soon as I get done with these emailed in questions. But start asking your questions. What specific questions do you have? Did you not know about Medicare, or you still don't know about Medicare that you would like? And we'll get to that in just a second. But the first one I had here was from Tony, who says, what will the potential changes of Medicare be post-election this year?
This year was a pretty impactful year for the Medicare system, I'll say overall. There were bigger changes, and most of the big changes were on the Part D side of things. So I'll talk about that. But overall, the Medicare system is something that does change every year. Important to know that. And just as your healthcare situation is going to adapt, so are the plans, and so is the government structure of this whole process. So just be aware of that. Digging into the specifics from this year, Part D changed pretty significantly, and that is the most notable change is that the maximum out of pocket that beneficiaries can pay for their prescription costs has significantly dropped. Last year, it was getting close to $6,000 that individual consumers could spend on out-of-pocket drug costs, and that's even with insurance coverage through Part D. Mm-hmm. Now, the maximum out-of-pocket for drug costs has been limited to $2,000, and that's, of course, assuming that you have proper Part D coverage, your medications are covered by the plan, but $2,000 is the new limit for medication costs out of pocket to the consumer. And that brings all sorts of changes to the market because, of course, these insurance companies need to adapt to that change, just like the consumers that are enrolling in the plans need to adapt.
Well, and that kind of brings up actually another question that I had for you that I'm glad you just reminded me of was when it comes to the drug aspect of Medicare and getting on Part D. Now, I've seen some people that choose to just forgo Part D altogether because of all these new, call them wholesale drug websites that have been popping up. You know, you've got your GoodRx, you've got your whatever the one that Mark Cuban does. You know, you've got all these different healthcare or these drug wholesale websites that a lot of times you can get medications cheaper through that than you can even with an insurance policy. So is that something that you factor in when you're looking at should somebody take a Part D if their medication is only $8 a month on, GoodRx?
Definitely. I always suggest, consider all options. Always consider the alternatives and be aware of what those are. Of course, there's so many things to consider when you think about Part D planning, and some people look to self-insure. Some people look to GoodRx and other resources like you're talking about. Some people just go with the straight up Part D plan. Mm-hmm. I think it's important to know, specifically with the drug coverage, of course, you'd assume most of the costs and all of the kind of benefits are going to revolve around the medications that you take. So if you're taking some of those lower cost medications where you can maybe just get access to them through a GoodRx or another resource, it's definitely something to consider. The only thing you want to, or the main thing you want to keep in mind is if you forego Part D coverage, then you're going to be exposed to a Part D penalty when you eventually enroll in Part D coverage in the future. So if you do enroll in Part D, let's say a couple of years after you've been just using GoodRx for your medications, then you're going to have an added penalty onto your monthly premium that you pay. But for some people, that might actually be worthwhile to take on the penalty because they might be saving money in the roundabout way. So it's important to consider everything. But yeah, there's good ways to kind of loop in and out of what your options are.
And so what other types of penalties? You're talking about that. Are there other types of penalties that people need to be aware of that could hinder what they're trying to do?
Yes. Yeah, there's two penalties with Medicare. There's the Part B penalty and the Part D penalty that I was just talking about. They work a little differently. Part B, both of them revolve around your late enrollment, I'll say. If you don't enroll when you have no other credible coverage, then you're going to have the late enrollment penalty added. And you can still only enroll within those different enrollment periods. So for example, if you miss an enrollment period and you don't have credible coverage, then you might have to wait several months until you can actually enroll in Part B or Part D, whatever it is that you left uncovered there. And then those months or potentially years that you go without that coverage, they will factor in and add on some premium penalties when you ultimately go back and enroll in Part B and Part D.
So I'm 65, 66 years old. I'm not taking Social Security yet. I thought Medicare was just going to automatically get enrolled because I heard that from my neighbor. I haven't enrolled in Medicare. I don't have Social Security coverage for them to do the automatic enrollment. What happens to me? I haven't enrolled in A or B. Nothing's happened yet. So what am I looking at moving forward now?
You're not stuck. You're never stuck. There's always things you can do. Again, it comes back to enrollment periods. You're going to have to wait until you have eligibility to make a enrollment, whether that's into original Medicare or some supplemental option that you need. There's only penalties for Part B and Part D. So as long as you have coverage there, you're going to be good, but subjective.
Cool. It's always good to know the penalties to try to avoid. Let's see here from Cindy. She says, the new Inflation Reduction Act of 2025 Part D for those 65 and still working on their employer insurance. How will it affect us and what do we need to do? If my husband and I are both 65 and he wants to retire and I'm still working, is it better for him to go on Medicare or should I carry him on my employer insurance? Okay, so this sounds like it covers a lot about what we were already talking about a little earlier about, my spouse is still working or I'm still working and my spouse isn't. Is it better to go the employer plan or Medicare? And I believe if I remember this correctly, your answer was it kind of depends.
Yeah, it depends. People always want to know what's the best plan. And my answer for them always is it depends because it depends on what their situation is. What I would tell Cindy is that you got to weigh the different factors that I mentioned. You got to weigh your health situation, financial status. What's the coverage that you currently have? If your coverage right now is really great and you're comfortable paying the premiums for it, you might as well have you and your husband on that coverage moving forward. If it's something that you think could maybe improve, I find it's always worthwhile to consider those options and just learn about what the alternatives you have are. Perfect.
So, Cindy, we'll connect offline and get you in touch with Dylan so he can answer those more specific questions for you. Let's see. We got a question from Todd that just says how to choose. Todd, it sounds like there's a lot of moving parts here. So again, I would recommend whether it's Dylan or somebody else, get with a specialist. That's how you're going to choose. It's fine with somebody who deals with this on a day-to-day basis, and hopefully they can help you in the right direction. Make sure you get signed up with the proper plan. Okay, so we've got Doug next. He says, interesting in registering in Medicare. I'll turn 65 in November of 2025. When do you recommend that I talk with somebody?
Very good question. If you're turning 65 in November of 2025 and you are planning on starting Medicare right when you retire, then I would probably recommend you start talking with someone in the early parts of the year next year. So that can be just a brief conversation, maybe in February or March, to get some introductory information, start learning about what you should be considering. And then I would kind of refer to it as like a slow drip. Over time, as you get closer to that 65th birthday or the retirement date, you're going to want to start ramping up how much you're paying attention to and get a little bit more advanced with what do I look at beyond original Medicare.
Okay. Perfect. So let's go. We've now got one from Chris that says, my husband has VA for all of his medical care and prescriptions. He also has Medicare Advantage plan mainly for ambulance coverage when he needs it. He is also in hospice that is covered by the VA. Is there a way to not have Medicare B or the Advantage plan so he can have a little extra money?
Good question. Very good question. So it's
A little bit
going
more
to come
in-depth on that
down.
one.
Yeah, again, it's going to come down to what is best for you both financially and health-wise. So if you've got VA coverage, then there's different levels to VA coverage as well. So depending on what your benefits are with the VA, then you could potentially remove the Advantage plan. You could even go without Part B coverage, but that comes back to the penalties we were talking about. If you aren't paying your Part B premium and you don't have Part B coverage, then you're going to be exposed to a penalty once you go back to Part B. And to talk a little bit on how they kind of coordinate together, if you don't have your Part B in place, then you actually can't have a Medicare Advantage or a Medicare supplement plan. So need to have Part B for those.
So you got to have Medicare B if you want the Advantage plan or any of the supplements. How does the VA coverage affect Medicare? Like, how do those intertwine, though?
They interact in a few different ways, but they kind of stay separate, mostly because VA benefits are only going to be usable at either a VA hospital or in a situation where you go to your VA doctor and they refer you out to someone else. So they coordinate sometimes, but they don't overlap a lot. People that are in this situation where you have VA benefits and Medicare benefits, it's usually a good situation, meaning that you're going to have multiple different options for where you can receive coverage and how your coverage is going to work. It might be a lot of information you need to retain, but usually a good situation if you've got that option.
Let's see here. Next question was from Lawrence. He's asking, what are the most common mistakes that people make when choosing a Medicare plan, and how do I avoid them? I think we covered a little bit of that already as far as the most common mistakes, and avoid them. From what it sounds like to me, the best way to avoid this is education. Either on Medicare.gov or talking to a specialist that does this day in and day out. Dylan, are there any questions that you can think of that we haven't asked yet that you think would be beneficial to people?
I'm trying to think through some of the questions that I get asked most commonly, and I think it really just comes back to kind of like the question that Lawrence actually submitted, and that was, how can you avoid making those mistakes? Again, I'm going to come back to right where I started today. It's subjective. It comes down to your own situation. You definitely want to know how the overall system works, but just don't make any assumptions, and definitely don't take unfounded information and kind of run with it. If you hear from your neighbor that the best plan for you is plan A with XYZ company, then do your own research on plan A with XYZ company and figure out if that would actually be a good fit for you. You talked a lot about kind of billings and claims questions. Again, I think it comes back to what I said earlier. Work with someone you trust. Maybe you have a contact at the healthcare facility or someone. Just sit down and talk with someone that can kind of help you break down these numbers. You're not alone with this situation, but if you isolate yourself, then you are going to be alone, and then you're going to run into situations that can be a little bit more difficult to handle.
Oh, you just brought a question up in my mind, is that you mentioned the different insurance carriers. If somebody is comfortable, they've been on, Blue Cross Blue Shield or whoever for, with their company for forever, and now they're going to get in Medicare, and they, is Blue Cross Blue Shield necessarily the best for them? Is it the cheapest for them? How do you decide between carriers?
So there's no crossover or coordination from your past coverage into your Medicare. There's not going to be any carriers that will say, hey, you've had coverage with us for 20 years with your work plan, let's give you a discount on your Medicare. Unfortunately, that's just not how it works. I would say the most important factors to consider with the carriers on the carrier level are, of course, what products do they offer? How do they fit your needs? Mm-hmm. But also, how do those companies work? Are they reputable? Have you done some research into kind of maybe their claims process? Are they easy to work with? How do you work with them when you talk with their customer service and things? Do you find that they are receptive to your questions? Are they actually giving you good answers, or are they kind of just not really giving you the answer that you're looking for. So all subjective, all personal with Medicare, and the differences between the different carriers are usually smaller than one might think.
So it sounds like when it comes to Medicare, it's very similar to a retirement plan, is that there is no one-size-fits-all solution. It's let's see what your problems are, let's see what the solutions are that fit your problems, and then let's build a plan around that.
Yes, that comes back to why I got into Medicare in the beginning, and that's just that it's very subjective. It is addressing problems that different people have. Everyone, when they become Medicare eligible, is going to need to make a decision there. And that means they've got a problem on their hands. They've got to deal with whatever that decision might be. I really enjoy looking at each specific situation and figuring out what's going to be best for them, because when people come into Medicare meetings, they're often kind of guarded and just confused. They've got that kind of look in their eyes where they're like, holy crap, this is a lot of information I need to learn, and I need to control all this and know exactly what happens in this situation. You're not going to know everything. You're not going to learn everything. I'm still learning things day by day when I go about this, but just pursuing whatever is going to be best for you, and based on those things I talked about earlier, your health, your finances, your risk aptitude. Some people don't mind taking more risk. Some people would prefer to not pay anything out of pocket if they get into a health situation, and they're willing to pay out in premiums in order to avoid that later on headache. So very subjective.
Perfect.
It's my word of the day, I think.
Well, it's a good one because it's true, and it works around all of this. So doesn't look like we have any other questions coming in. Dylan, I want to thank you. Thank you for all the information. Thank you for answering all these questions.
Thank you.
And thank you for just kind of being open with everybody to being able to help. So
glad to do it, Jaimin. Thanks for having me. This was awesome.
Yeah, and we'll probably we may do it again next year around the same time period. So that way everybody, or we may do it a month earlier next year, so that way they can have this information before the enrollment period. I want to thank everybody for coming today. Again, if you have anything, please feel free to reach out. But that's all we've got for today. So thank you, and look out for the webinar that we've got going on next month. Thanks.